Thank you and good morning. I represent the college and the board of OBGYN, but what I'm talking about really is about women's health. When we treat the diseases and the consequences of disease or trauma in women, we're deeply engaged in dealing with social determinants of women's health. And the traditional biomedical approach that we still unfortunately train many of our professionals in doesn't speak to these causal pathways in a way that we can move it forward. So just think of education. Think of how profoundly education affects women's health, girls' health. It even affects the next generation. So intergenerational health is affected by social determinants of disease. We know, for example, that greater education of women translates into less death of children under 5, a simple thing. So from our point of view, the framework that you work from has to be very broad. It has to look at health literacy, something we continually deal with in populations. Health professional and beyond education, working in women's health internationally, the education of the legal profession about social determinants of health is equally important. Lifelong education, all of us can never stop learning. Community engagement. How do we do that? How do we partner? How do we make that part of our professional education and our responsibility as individuals and as societies? We also would like to see a framework that incorporates sustainable means. Funding for health science education is a reasonable option. So funding for education that supports engagement of a broad set of community activities, professional societies, legal societies, knowing how to prioritize, understanding implementation science. And funding for research that focuses on community implementation and collaboration. We would like to see this framework cover the 9 knowledge domains that the WHO looked at for the Commission on the Social Determinants of Health. Of course, for us, women and gender equity is an important one. We also feel very strongly that professional societies are accountable for their role in changing, addressing social determinants of disease. And so we hope in the framework that gets addressed. So knowing isn't enough. We would like to see the framework expanded to include lifetime education beyond the medical enterprise, sustainable means for education, for engagement, and for research. We'd like to cover the 9 focus areas of the WHO work, and we want a framework that assists in long-term engagement with civil society and professional societies. Thank you.